Okay, so tell us who you are and what we're here to talk about today.
My name is Helena Adjekum-Persaud. I'm the clinical manager for surgery and surgical oncology, as well as the B3 Surgical Ambulatory Clinic here at the Juravinski Hospital. I'm going to talk about care rounding.
Okay, so tell me what CARE is. What does CARE stand for?
Okay, so care rounding, the C in care stands for comfort. So on our unit, when we do care rounding, we ask patients if they're in pain. We ask if they're comfortable, if they need a warm blanket. And my favorite, we ask if they need water, because on my unit, I'm actually the water girl. That's my designated task. A stands for activity. So really trying to mobilize our patients, getting them up, getting them moving. We are a surgical unit, and early mobilization is key to early discharge. So really making sure that our patients are up and moving is part of the things that we do with care rounding. If our patients are not able to get up, we're also making sure that we're repositioning them as well and decreasing pressure injuries in that process. R is for restroom. So we're asking the patients, do you need to get up to use the bathroom? We're changing briefs where needed. And in terms of E, that's environment. We are in the old wing of the hospital, so environment is very important for our patient safety as well as our nursing safety and our team safety. So really making sure that the area is clutter-free, that the area is clear of any types of trips and falls, and as well as just making sure that the patient's areas are neat, because we know that when you have a neat bedside, you are actually comfortable and you are happy.
Okay, so CARE is comfort, activity, restroom, environment.
Yes.
So really, what's the overall purpose of care rounding?
The purpose is for an overall approach. So not just nursing focused, but as a team approach. When we care round, our allied health are there, our business clerks are there, myself, our clinical leader, our educator. It's truly an all hands approach. And so care rounding allows people that would not necessarily be frontline or caring for patients in a specific way to actually get to know our patient population as well.
So how can the entire team support the well-being of our patients?
That's exactly right. And everybody has a role.
I love that. Everyone plays a role. Everyone sees the patients as a full person, and we support their overall well-being, not just the medical care.
Yes,
that's really exciting.
Yes.
Yeah. Okay, so tell me about the impact. What successes have we seen with care rounding?
Patient satisfaction. Absolutely. Some of the feedback that I've received from patients and families is that they know who the nurse is. And so one of the feedbacks that we're getting from family members is, I know who my nurse is. I know what date it is, or my family member knows what date it is. And I'm seeing people come in. And I'm seeing people engaging with my loved ones. So very positive feedback in that aspect.
So you're really embedding this idea that it's a team-based approach in all of your activities on the unit. That's
Absolutely.
Fantastic.
Absolutely.
And it's communication, right? It's always about communication with the family, with the team members.
Absolutely.
It sounds like you're building that strong community.
And everybody has a skill or everybody has a role that they play. Mm-hmm. So if we're going in and it's, let's say a physiotherapist and they have a question or, I'd really like to go for a walk. We're really trying to emphasize that it's not just a physiotherapist's role to, help mobilize the patient or get the patient up and moving. We've got a healthcare aide there that knows how this patient transfers because it's on the whiteboard. Well, let's take them for a walk. So really engaging staff in roles that they might not typically do, but that they can do, and supporting the patients in the process.
Okay, change gears slightly. Let's do a fun question. If you had to describe this initiative with 2 or 3 emojis, what would they be?
Emojis.
My sons use emojis for everything.
I think it's I would say happy face. The exclamation mark.
We don't even know the names for them, do we? I know.
But I'm picturing it. The ones with the because that was how our team felt initially when we started. It was just like, why? Why are we doing this? And then I think after the first day that we actually did this, and then the first week, then it was like, oh, okay, this is not bad. 15 minutes and we are doing this. And then it was the happy.
The light bulb moment, maybe? I don't even know if that's an emoji. I have no idea.
I think that's the best we can do. That was a good effort.
Fair enough. And really, what does this mean to you when you've started this work? Is this a meaningful part of your job?
This is absolutely meaningful to me. My background is nursing, and as I said, care rounding is not new. So this is something that I think really brings the team together. On EF4, 70% of our nurses are less than 3 years experience at HHS. So I also see care rounding as a way of really building a community within our team. So we mix up who is supporting who on a given day. It's not the same people at the same time. And so we're really getting to know each other on another level that we would not really have that opportunity to if it was not for care rounding. So I am absolutely in support of it. I have an apron that the staff made for me that says Water Girl, that I walk around proudly with my water and, supporting the patients with that. But really, I truly believe that if you have leadership buy-in, that the team will at least see that, they truly believe in this, and it's not they're just asking us to do this. They truly want this for our patients, and I truly want this for our patients.
And I love that you are championing this, but you're also the water girl. That's fantastic.
Also the water girl. Absolutely.
That's wonderful.
Thanks.
Thanks so much for sharing this with me today. I love that it brings teams together. I love that it's focused on overall patient wellness. I love the excitement around it. Thank you so much for your work and everything that you do.
Thanks for having me.